Tomorrow marks 2 months since the first case of COVID-19 was announced in our province, and since then, there has been a lot of misinformation on social media. But a doctor in Saskatoon has been working to debunk what he can.
I do believe that the two doctors from California have caused a lot of misinformation, a lot of fear, and a lot of...
Dr. Hassan Masri is an internal medicine and ICU specialist and an associate professor of medicine at the U of S in Saskatoon. Back in March, he started posting videos about COVID-19 to social media for his friends. Now those videos reach well beyond his friends. He joins me now. Thanks so much for your time.
Thank you very much for having me. Appreciate it.
What has your experience been like as an ICU doctor through this pandemic?
I think it blows my mind even while you're speaking that tomorrow is 2 months from the day that this whole madness has started. And when I look back, I almost cannot remember what it was like 2 months and 2 days ago. Things have changed significantly. We are now used to greeting each other with masks, whether in the hospital or in the grocery store. And now we show our affection and our love for each other by staying away from each other. And the more I like someone, the more I stay away from them. Those are all very strange concepts if we talked about them in February. And so I am like my fellow citizens, affected by these things, affected by the fact that cannot see my family or visit other cities where other family members are. Those are all the experiences outside of the hospital, but also inside the hospital, despite the fact that we've done really well here in this province so far. Life in the hospital has changed quite a bit. All these measures that I talked about exist in the hospital. Certainly what is really difficult for me every day at work is not seeing the families of my patients, being able to interact with their loved ones or being able to join us for questions and rounds. Those are things that really impact us at work. And of course, everybody in the hospital is worried about the same things that everyone outside of the hospital worried about, which is not to get COVID-19 or take it home to their loved ones. Those are all some of the concerns, and it's amazing to know that we have now been dealing with this almost for 2 months.
You've become very active on social media. What was the thinking when you posted your first video, and how has it changed over the last 8 weeks?
I'm still trying to understand and figure that out. It may take me 2 more years and 2 more months to figure that out. You know, I've always been someone who's somewhat active on social media, but the definition of that used to be that I would try to reach out to maybe 100 people or 30 people, or if it's something that's really funny or really political or really controversial or related to sports, maybe I'll reach 100 people. And that was my definition of going viral. Interestingly, it took a pandemic for me to be more involved and to understand the power of social media. I think that initially, and many times during the last 2 months, I thought, you know what, I should probably stop and stop using social media. But every time I thought that maybe no more videos, or I should slow down making videos, a controversy or a myth will come out of nowhere, and I feel that there is a vacuum. There's a lot of questions, and if we don't jump in and help answer those questions, those folks who are producing this misinformation, whether it was local misinformation here in Saskatchewan a few weeks ago in Regina, or the 2 physicians in California, or the newest misinformation out of the United States. There's a lot of questions. People want their answers, and unfortunately, misinformation sometimes looks really appetizing. And so therefore, I felt that the need to address it. And of course, the support and the kind words of the people of my province and this country kept me going. And it has become almost now a second part-time job to just keep up with all the information and present it in a way that's easy to understand, and that's factual and evidence-based.
What's the most common question that people are asking you?
The most common question people are asking me is, when is this over? And I give them the most common answer, which is I don't know, and really, truthfully, no one really knows when this will be over. But common questions people have. I think we have to appreciate that people are worried about things that you and I would be worried about. If I buy food from the grocery store, will I take it home to my kids? If I drop something off at my mom's house, even in a sort of physically distant way, will I infect my dad and my mom who are a bit older? Um, can my kids interact with other kids? Is takeout safe? Should I cancel my wedding? That's a really common thing, right? Summertime is coming, and a lot of people were ready to celebrate their love and their weddings. So those are some of the really, really common questions. But then also there's all these other questions that people who say, I know these videos and misinformation and things that are being spread out there. I know they're not true, but can you just assure me? I trust you. Can you just assure me that you also think it's not true? People are worried, and sometimes when people are worried and in a scary place financially and physically, and there's a lot of, unfortunately, fear around them, they're easy to maybe be swayed or maybe even made to question things that they would never question otherwise. And so I get a lot of questions privately from people, sometimes even in the medical field or other places, say, I really know deep inside that these videos that these folks are making are not true, but do you feel that way? Can you make a video about these things? And my response usually is initially is absolutely not. I will not make a video about this nonsense. But then a lot of questions come through, and I feel that despite my strong beliefs that these videos and information are not true, I think people deserve an answer. And I many times in the last 2-3 videos, I've made some videos just to address these major concerns that people have.
Dr. Mastery, what's the most frustrating thing you've seen online?
I think the most frustrating part that I've seen online are things where people, you see, we have a responsibility. I mean, it's hard to think of social media as a place where we still have responsibility, but we really do. And I think the most frustrating part for me is people who post these videos with titles like, well, that's interesting, or that makes you think. And the reality is, even if you don't believe in these videos, and if that's and that you're trying to get other people to think, I think that's a really dangerous approach. We really this pandemic has highlighted to me a really major issue with our use of our social media, and sometimes our feel that there is an element of free speech and everybody should post whatever they want, and that is true. I am all for that, and I am against any censorship, but I'm also for the fact that people have to take responsibility for what they post, and for what they say, and understand that there are other people who may not have the same background, whether it's education or access to information or understanding of medical information, and may take things at face value, especially when it sounds really, really good. And I really think that as a society going forward, we really have to start thinking about how do we advance going forward in difficult times without censoring anything at all, but enhancing people's self-responsibility about what they say and what they share and what they post.
What do you make of the case counts here in Saskatchewan versus the rest of the country?
I think that I'm honestly not surprised of the case count in Saskatchewan, and while I appreciate what the government and health organizations and health personnel have done, I think that the credit goes to the people. The people here in Saskatchewan were quick to jump on board with all the guidelines and all the recommendations and flatten the curve. I mean, we've asked them to flatten the curve, and they flattened the curve. And I think that their adherence to the rules was incredible. I mean, if you now, before we loosen the recommendations a little bit, if you think of a few weeks ago, I mean, the streets were empty, the walkways were empty, the trails were empty, stores were closed. People were extremely adherent to the rules, and I think that we are protected by the fact that we're not heavily dense. But I think we're also, this is Saskatchewan, and people here practice common sense, and people understand what's good for them, but also care about what's good for their neighbors, for fellow citizens. And I think I'm not surprised. And I think when this is all said and done, there will be books and articles and studies about how we managed to flatten the curve so well, even though initially it looked like numbers were really rising. And then we went on for almost 2 weeks having 1 or 2 cases a day. I'm not surprised. I'm very proud.
What about what's happening in the north? You're in Saskatoon. Those are the closest major hospitals to the north. What do you make of the situation happening there?
I think that you know, as people of this province, we have to understand that while the numbers are always reported by regions and things like that, that the virus doesn't really respect any boundaries, and that the people in the north are no different than the people in the south, and the people in Regina and Saskatoon are no different than the people in Losh or anywhere else. And certainly, I have great concern for my fellow citizens in the north, and I hope that our aggressive approach in testing now and tracing really aggressively will get the situation under control. But I also think that going forward, beyond the pandemic, we really need to, as a society, as people of this province, need to understand that we really need to invest in our fellow citizens and make sure that they have the same access to everything that we have, and that's the only way to true prosperity, and to making sure that we are all on the same page.
Looking down the road, I know you've already said we have no idea when this is going to be over. What's your biggest concern going forward?
I think my biggest concern is that we have examples of other countries and other regions in the world who have managed to do a really, really good job like we did. Whether it's Germany, whether it's South Korea, whether it's some islands in Japan or Iceland. Those are all examples of places that have done really, really well. But the concern is, in some of these places where they did really, really well, is that when restrictions were loosened, people thought that it was back to normal. And it only takes a few weeks for the virus to become so infective, in the sense that one person, this word of R naught or R0 is, or reproduction or reproducible rate, where the virus becomes extremely overwhelming to the system. And so my biggest worry going forward is that if we forget about all the precautions that we're supposed to take and treat this as, the cases are 0 in my city, I have nothing to worry about, we're going back to normal. My worry is that we will go back very quickly to a very tough place. And so that's really my biggest worry. And I hope, and so far, I think the people, for the most part, I know there's always people who could do a little bit better, but for the most part, people are doing their best and staying by the rules.
Thank you so much for your time today.
Thank you very much for having me.
Dr. Hassan Masri is an internal medicine and ICU specialist and an associate professor of medicine at the U of S in Saskatoon.